Okay, so I'm Becky Bond, and I am so happy to be here in this room. For a lot of my career, I spent a lot of time in rooms in D.C. with a bunch of people who talked about politics, but who I came to find out, you know what I mean, when you really needed people, right? When we really needed to do the work, that's not where the work happens, right? It's in rooms like this, and so these are the rooms and the church basements that I really want to be in, because what I want to do is I want to change things. And I don't want to just talk about things, and I don't want to just go to meetings. I want to change things. For years, Democrats have been telling us that big change is not within reach. And according to the conventional wisdom, they say the left will never be able to govern. So just do not even try to run candidates like Bernie Sanders. Don't try to push for policies like Medicare for all or free college tuition. The neoliberals have been telling us the only way is compromise and incrementalism, and we can't question capitalism, right? That's what they tell us in Washington, D.C. Now you take the other guys, you look at the Republican Party, they clearly believe big change is possible, right? They're making huge radical changes every day, like 4 or 5 of them. There's not even one at a time, right? I mean, what could be more radical than what we're seeing as they're like literally separating families and putting children in jails on U.S. soil? What could be more radical? And they're just doing it, right? They're just doing it. So no one can tell us that big change isn't possible if you have the political will to make it happen and you have the people, right, to make it possible. We have a not so radical idea, right? And that idea is that as a nation, we should be able to guarantee that we can provide basic dignity to all people who are here, right? A place to live, enough food to eat, access to education, and the ability to see a doctor or a nurse when you're sick. That's not so radical, right? Right? If they can make these big radical changes, right, we can make these not so radical changes because the people are behind it. Now, the Bernie Sanders campaign, and I know not everyone in here is a Bernie person, although maybe they are. It did radically change, you know, our sense of the scale of change that's possible in this country. And not just people that supported the Bernie campaign, but I think across the country, it really, really did wake up a lot of people that if we propose the big radical solutions to our big radical problems, you know, that the people will engage, right? And that the people are for bigger things than we've expected of them. And it's not just what happened in the Bernie Sanders campaign here in the United States. If we look to the UK and we see what's happened with the movement behind Jeremy Corbyn, right? And the grassroots force, a lot of young people, a lot of people new to politics that got involved into that party leadership fight, that's really changed their sense of what's possible in the UK. And I've had a really front row seat to all this. You know, in the 2016 cycle, as Holly mentioned, I was a senior advisor for organizing on the Bernie Sanders campaign, and I traveled all across the country organizing volunteers for Bernie, and it wasn't just for Bernie, it was for the ideas that Bernie ran on, right? That's what the volunteers came out for. And it wasn't a typical campaign. I mean, Bernie started out with 3% name recognition, 3%. And by the time we got to the convention, we had 46% of the delegates, right, to the Democratic National Convention. Like, single payer is polling better than that, right? And so, you know, of course, you know, Bernie didn't win, so I appreciate you're asking a loser to come up and talk. But according to the conventional wisdom, we never should have gotten that close. Never should have gotten that close, right? And it wasn't because of Bernie, it was because hundreds of thousands of people got involved, right? And they got to work. And we defied the cynics, and more importantly, we defied the political professionals, right, who've been telling us that this is not possible. And we became very close to a shocking upset. And one of the things that made that possible is something that, you know, you all are engaged in and the nurses are really doubling down on, and it's something that we call big organizing. And this idea behind big organizing, you know, at the heart of it is this idea that there is this huge but largely untapped capacity in the grassroots that's ready and willing to be called into service, okay? And many of them, not only are they ready to be called into service, but a lot of them are ready and they can make big commitments right now, right? Not small commitments, they're ready to make big commitments. And with the right kind of management and support, their efforts can be scaled in ways that a generation of organizers working on the Alinsky model with slow one-on-ones, incremental policy goals, and a ladder of engagement just could never, ever do. So we're in a moment where a lot is possible and a lot of people are waiting for us to come and make it possible for them to make the big commitments to help us do the work that we need to do. Now, on the Bernie Sanders campaign, we iterated a lot of tactics. We had like a short period of time and a huge number of people and dollars in technology to back this up. And we learned a lot of things on the Bernie Sanders campaign that we've been using since the campaign in advocacy campaigns, including the fight for Medicare for All in California. And, you know, I'm here to tell you, and Holly can tell you, and those of you who've participated in the work in California, are tell you that it works, right? What we did on the Bernie Sanders campaign, not only does it work, but it's working better, right, than it was on the campaign where we are in California. So I believe that any organizer with a big goal like Medicare for All, who has a movement to tap into, and we have that movement, and a plan to win, and you in this room and the nurses have a plan to win, right? We can use big organizing to back that up and build the power we need to pass the policies that we so desperately are crying out for in this country. We can talk to everybody, not just some people, everybody, about the real solution to our healthcare crisis, and we can build a majority, maybe a supermajority, we probably need a supermajority, right, to stand up for change. And this is exactly what the nurses are doing, and what everyone who wants to throw in with the nurses are going to do. Now, I really believe that this moment we're in, it is a big organizing moment for Medicare for All. People are waking up to the fact that the Affordable Care Act made some things better for some people, but that it just doesn't even come close, right, to solving the basic problem. And they don't need to know all the stuff that you all know. We don't need to explain how it's going to work. We don't need to explain all these details. We don't need the detailed policy analysis. They may not even need to know the critique of capitalism, but they know what we have now doesn't work. They know people are dying, people are going bankrupt, right? And they're ready, right? They're ready for something else. And we know that something else is Medicare for All. So it's also in this moment we want to recognize that we're in, and I know a lot of us have felt this, is that all these people, we have this thing called the resistance, right? And so a lot of times we call it hashtag resistance, right? Because they're not really given a way to resist, right, and change things. And we see people marching, and then they're saying, okay, we've marched, now what? Okay, we've donated, now what, right? They're ready to be put to work. And this Medicare for All movement is the perfect vehicle for them to put all of this energy in wanting to change things and wanting to make a better world. This is how they can do it, but they need us to create the campaign that asks them and welcomes them, and most importantly, gives them something big to do. Okay, so I did write a book. It was called Rules for Revolutionaries. One of the rules in the book is, if there are no nurses, I don't want to be part of your revolution. Yeah. So one of the keys is, and it's not necessarily about the nurse union, it's like nurses, right? Inviting people to do something. Well, I can invite people to go canvassing for Medicare for All, and some people show up. If I invite people to go canvassing with nurses for Medicare for All, a lot of people come, right? People like nurses. It's powerful, right? So you have the leadership and personal appeal of nurses who bring so much authority, lived experience, right, and authenticity to this fight. And then the unions, the nurses union and other trade unions and other organizations, they bring infrastructure, they bring discipline, they bring strategy, they bring accountability, they bring targeting, right? That unions bring to fights because they know how to win, right? And so when you have all of these volunteers looking to plug into something, I can tell you, it's a magic, we're learning in California, it is a magical, combination. I'm not a nurse, right? But I've seen how powerful this is, and so whenever I want to do something, I want to be able to say the nurses are going to be there, right? So we have a theory of change, and we need to identify and organize enough voters to overwhelm the establishment politicians who do not want to defy the insurance companies and do not want to do what's right for their constituents, right? And so this means not just preaching to the choir, it means talking to everybody. It means talking to Republicans. It means talking to independents. It means talking to people who we think might not be with us, right? And that's going to take a lot of people. So I'm so excited about the leadership of National Nurses United, and in particular the new executive, Bonnie Castillo, who's not here, but I know she wanted to be. And Bonnie specifically is, and a lot of you don't know her yet, you really want to get to meet her. She's driving the strategy of big organizing and a constant campaign that I've heard some people talk about, constant campaign and the need to be out there all the time, but I've just seen very few leaders actually make it happen, right? Bring the resources, make it a priority, bring the staff to it, and that's exactly what Bonnie's doing. And when I first met Bonnie, we had a conversation about organizing when we were both in Nevada for Bernie during the caucuses. And I was struck then, not just by how radical her vision was and what change that she thought was possible soon, but also just how closely she was paying attention to what it would take to make it happen, right? The nuts and bolts of it. And so when I think about leaders, who are really changing things through people power, obviously I think about Bernie Sanders, I think about Jeremy Corbyn, but I think when the history of this moment is written that we're also going to be thinking and we're going to be seeing and learning about Bonnie Castillo. So I really believe that. Now, when nurses ask people to get to work, we are seeing similar responses than we saw on the Bernie campaign and what's happening in the Corbyn movement. And in fact, we've got some people from the Corbyn movement that are working with us on this campaign. And hopefully you'll get to meet them. And they came over and they met the nurses, they met Peter and a bunch of his people from UE, and they were like, Medicare for All movement, this is it. This is like what we're doing in the UK. We want to help, right? So it's not just me saying this, it's not just the nurses saying this, but people from other countries that are pushing back against austerity, that are trying to defend their own healthcare system, they're looking to this too. So when we ask people to come out, what are we going to be asking them to do? Well, our tactics are going to be having conversations with voters at scale, right? And not just, reading a script and checking off boxes. We're talking about having conversations. And yesterday, Mary Beth from Maine said something I thought was really important very quietly when she was up speaking. She said, a lot of talking to voters is about listening, right? And I think that's something we haven't done very well, right, at least as a movement. So we have to have conversations with voters at scale where we listen, right? And where we convey our message and how we feel, and then we have to keep track of those conversations so that when we need those people to put pressure on politicians, we've got an army behind us, right? So get back to the slogan we talked about yesterday too, everybody in, nobody out, right? That's not just about the healthcare plan we're fighting for, right? That is about this campaign, right? And about everybody that we need to talk to. So how are we going to do this? All right. I'm going to share a few key things that we learned on the Bernie campaign that I think are really important for how we're going to scale up this movement of talking to voters at scale and having the conversations with them that are going to move enough people so that we can overwhelm the system. Okay, the first thing is that people are just waiting to be asked to do something big to win something big. And the converse of this is that people are less willing to do something small to win something small. And I think this is just a really important principle of our time. Not enough people are asking people to do the big things, and they want to do the big things. And in fact, if you ask them to do something small, they're going to be like, how is that going to make a difference? How is the small thing going to change my life? But if you ask them to do the big thing, to win the big thing, even if it's a long shot, they're like, I'm in, right? Because if we win this, we win, right? And that's important. The second thing, and I think this crowd knows this, but it's really important to articulate, is that we need solutions as radical as the problems that we face. The problems that we face, they're crazy radical, right? And when you have a crazy radical problem that's literally killing people, and the people that are supposed to be in charge and responsible, they're never going to do anything about it, then the only practical thing for us to do, right, is go for the solution that's actually going to solve the problem, right? We cannot just maintain the status quo or have things be a little bit less bad. We really have to go for the big solution, and it's not radical. It's practical. This is a bunch of practical people in this room. Okay, we need a centralized plan to win, but we need to distribute the work of it, okay? So this isn't crazy anarchist, everybody go do their own thing, and it'll be great, right? It's not about putting people in motion everywhere. It's putting people in motion behind a plan that is designed to help us win. Not a plan that's engaged to give everybody a part, not a plan that is just sort of reflects our values but doesn't get us across the finish line. We need a centralized plan to win, right? Like, think about marches, right? People can march, people can trend things on Twitter, people can talk on social media, and people can spend a lot of time on that, right? But if those things are not going to help us win, then it's not is not making a difference. One exercise I did was when all the Women's March happened. There was over 650 of them across the country after Trump, when Trump was inaugurated. And the newspapers counted up, they said 4.1 million people marched in those, right? And so that's more people than serve in the U.S. Armed Forces, by the way. 4.1 million people march, right? And if you just say, okay, those 4.1 million people, they all spent about 4 hours, right? A lot of people spent a lot more time. They made signs, they traveled, et cetera. But let's say the 4.1 million people spent 4 hours, right, on that march. Okay, so that's 16,400,000 hours of work, right? Okay, imagine if we spent 16,400,000 hours knocking on doors, right? Okay, if you take all the households in the U.S., you'd only have to knock 8 doors an hour to knock on every household in the United States with just the capacity that came out that day to march, right? Now, of course, it's a silly exercise because, like doors are far apart and, you know what I mean? A lot of them are behind locked gates. You can't do that, right? But if you think about how we can take mass participation from the realm of marching into the work of rebuilding our democracy and pushing for solutions that we need like Medicare for all, a lot becomes possible that we think is not possible, right? That was a lot of work. Okay, here's one that's often controversial. The revolution will not be staffed. I should have written it won't be fully staffed. So what I'm here to say is that, we need our movement to be big and powerful, and that's going to require, I think, a lot of full-time staffers who are locked in and only working on this. But, organizing everybody everywhere, we'll never have enough paid staffers to be in charge of that, right? We're going to need volunteers, right? Because we need everybody everywhere. So we're going to need to actually empower volunteers to do roles that staff often do, right? And so where we can have things be really staffed, that's awesome. But a lot of places we're going to need to have volunteers running things, and we need to recognize that we can't wait till we have enough staff, right, to make this happen. So in order to do this, we're going to do something which was hard for me. It's a leap. We have to put radical trust in volunteers, right? We don't have to wait, for people to throw in money or bring their institution. We just have to let the people that are ready to go take charge. And if we have a centralized plan to win, we tell them what that is, and most of them will do it, some of them won't, but we've got to have trust. And helping us to have trust, this is something that I learned the hard way, and maybe this is something you all know, but when you're working with volunteers, never ask who wants to lead, ask who wants to get to work. Okay? This is really, if you take one thing, if you do this, it really changes your life. When you ask who wants to get to work, different people raise their hand than when you ask who wants to lead. It's incredible, right? And as it turns out, the people that you want to be the leader, they're the ones who want to do the work. So you tell them later that they're the leader. But you never say that up front. You just make them the leader because they do the work, right? Okay, and then here's another thing, that I think sometimes that we don't pay enough attention to, and something that we've really learned from our friends in the Corbyn movement too, is that people new to politics and organizing sometimes make the best revolutionaries. And I really believe that in this moment, people who are new to politics and people that might be new to the struggle, they can make a huge difference. Sometimes they make a bigger difference than people like me who've been involved in this work for a long time. And we need to let people that haven't been with us forever at every step of the way, that don't know everything, we actually need them to step up and be part of our campaigns in real ways. And people who are newly energized around our cause, they bring new contacts, they bring new energy, they often want to do stuff that we think is not going to work. And sometimes they're right. Sometimes it's hard for the old guard to let go, for people that haven't been there or maybe don't know, but I think we're really going to have to do that if we really want to change things. And the movements that are changing things, we're seeing a lot of new people, a lot of young people, a lot of people that are too dumb to know how hard it's going to be stepping up to take on big things, and we need to let them do it. I've done that before. Okay, so these are just a few of the rules that we've articulated through our experience of working shoulder to shoulder with volunteers. And if you want to learn more about them, Zach Exley and I wrote a book for the volunteers that we worked with on the Bernie campaign so that we could share in one place the things that we learned together. And so if you want to learn more about, there's about a dozen more rules, including how to deal with the tyranny of the annoying, and which might be helpful. You can check that out. Okay, yeah. It's a really good chapter. That one. You're gonna wanna read that one. Okay. All right. So I want to get back. So those are some principles, and that's different than how we do a lot of organizing, right? So I do just want to sort of call attention to, like, we do want to think about some of this stuff in new ways if we're going to bring a lot of people together on this. But in California, we've really achieved a lot so far, and it's meaningful to me that the nurses, we were the first union to endorse the Bernie Sanders campaign, and yeah. And a lot of times the nurses will be the first people to do something that's kind of crazy, and then eventually it doesn't, might take years, and it's like, oh, that wasn't so crazy, right? So, I live in California, and I've seen the nurses be virtually alone among organizations that work on more than one issue. So not the people that have been working on single payer forever, but the organizations that work on more than one issue. I've seen them be virtually alone in taking on the speaker over this issue of passing our bill in California. And, it was eye-opening for me, right, to really take on the powerful speaker, Democratic speaker, and key members of the legislature, but they weren't alone among the people, right, which is what was so awesome. And so one of the things that we did was we said, okay, a lot of the democratically aligned organizations or the groups that work on multiple issues, they're like, we'll do one day of action every 6 months against the speaker, but we got to work on this other stuff, and we're not going to, stand in his driveway throwing rocks every day, right? We can't do that. And so we were like, well, why not? But people wanted to do that. They want to stand in the speaker's driveway every day and throw rocks. And so instead of the nurse union being out there on their own with their staff organizing their members, right? We've blown this up to 100 times the impact by saying, okay, the nurses, staff, and the nurse members are going to also organize people directly, right? Because the people are ready to go. And we started inviting volunteers to join the nurses' efforts that they would be organizing for their members. And it's been amazing. We invite them by email, by text messages. We do phone banks. We call people on the voter file, and we invite them to come do things with nurses. And they show up, right? It's amazing. And we train them on conference calls. The union sends them materials to print out. Union staff members or member nurses try and show up, where volunteers are doing things. But basically the nurses union have just expanded their membership in a way, right? By just everybody who wants to be with us and fight for this come and organize under the banner of nurses. A lot of them don't even know that there's a union involved. They just know they're with the nurses who wear red. It's just amazing, right? They probably think it's a hospital group, or something, right? So in doing this, we've taken an issue that was a non-starter, and we've turned it into the third rail of our state's politics. And literally in one weekend alone, volunteers had 10,000 conversations that rendered a supporting signature, right? In one weekend alone, right? And delivered them at the Capitol. And so many people have gotten involved, that the politicians and the other, nonprofit groups in the space, they've gone from thinking we're crazy to thinking we're dangerous. Right? Right? And what's so great about this and why we're talking about it here with this group of people is that, the nurses union has always done awesome organizing, well-resourced with amazing staff, great and disciplined members who show up for things, right? But by embracing this big organizing model and bringing volunteers in so that anyone in the community, whether they're a nurse or whether they're a union member or not, can participate if they care about everyone having access to health, not access to healthcare, having healthcare, right? They're doing things literally 100 times bigger, right, with the same staff and budget that they would have been able to otherwise. So this is the work that we want to work with anybody in this room, hopefully everybody on, right, to be able to do this. So this is the portion. Now we're going to sort of shift into talking about getting you involved in this campaign with us and learning about how you can do that.